Hi, I'm Dr. Pete Campbellos, a medical director at Buckeye Health Plan, and welcome to our Patient Experience video series. At Buckeye, focusing on patient experience is one of the ways we live our purpose, being your partner to better health. CAHPS and HEDIS are two of the best ways we gauge how we're doing when it comes to patient experience. And if you're a clinician, these are more than just acronyms. They're connected to your everyday work and your relationships with patients. I'm joined by my colleague, Dr. Shar Jwayed. Dr. Jwayed, thanks for joining me.
Pete, thank you for having me.
Let's start with talking about CAHPS. What exactly is that?
Well, Pete, CAHPS stands for the Consumer Assessment and Healthcare Provider and Systems Survey. Basically, every year, Buckeye surveys a random sample of our members to find out how they feel about the care they received. You know, the doctors that they see, the services that they received, how the plan supports them, the timeliness of care. It's all about their patient experience. We really want to get a good sense for the patient's experience.
And what kinds of feedback does the CAHPS survey collect?
Well, it focuses on important things to the patient, like how easy was it to find a provider, how easy was it to get an appointment with the provider, how easy was it to have timely care, and then how the clinical team communicated like the patient care plan to the patient's experience. It's basically trying to measure like a vital sign.
Got it. What about HEDIS? What's that all about?
So HEDIS is another tool that's used, and it stands for the Healthcare Effectiveness Data and Information Set. It's basically a set of national performance standards and measurements that's used by NCQA to evaluate how well health plans and clinical teams provide service and deliver care. You know, for Buckeye, it helps us to stay accountable for the quality and timeliness across the different care patients need, whether it's mental health, diabetes, hypertension, heart disease, cancer screening, prenatal care, all of the broad services Buckeye provides. It helps us keep track of the quality of care being provided.
And how are those scores used?
They're used by the plans, again, to measure quality. It's used by the clinicians to also measure quality, and state and federal agencies look at these scores to see how well plans are performing. For the clinicians, it's a good way to basically drive home to the patient that you're focused on the quality of the care that they receive and making sure that they get good outcomes. Again, patient experience is critical. Consider it as a vital sign. Make sure you focus on it to one degree or the other when you're seeing the patient.
And so why do improving CAHPS and HEDIS scores matter so much to the clinicians, to our patients, and to Buckeye?
That's a good question, Pete. The reason it matters so much is because if we understand patient experience and we can improve it, typically we can improve patient engagement. And patients that are more engaged typically have better outcomes. And that's really what all of us are striving for, is to make sure our patients have great outcomes.
Shar, that's great. And what's the best way clinicians can make a difference that impacts both surveys?
Well, when you're seeing the patient, when you're face-to-face with the patient, just consider asking the patient about their experience. Again, consider patient experience as a vital sign. You would certainly check all the vital signs. Just consider asking them a few questions about their experience. And if something comes up where you have the ability to improve their experience, either let Buckeye know or work on that within your clinical team.
Well said, Shar, and thanks for breaking down this really important information. And for everyone watching, thanks for being a part of the care experience. And stay tuned for the next video where we'll talk about how to start enhancing the patient experience one small step at a time.